Hello, this is David Dillard from Sleep and Sinus of Georgia again. And today I thought we would talk a little bit about some of the aftercare after sinus surgery, which is very specific to your own particular surgeon. And so I'd kind of like to just discuss how we do it and what you can do after. Let's start with the balloons because it's probably the most standardized aspect of this. And a little bit about balloon sinuplasty as it relates to the care of the sinuses and where it fits in the grand scheme of things. So one of the things that we can talk about is that the sinuses are basically steam rooms down a hallway. If the hallway is the nose, air is moving back and forth inside the nose. The pockets of steam that are in the sinuses help keep things moist, and they filter and they put hormones and they provide fresh mucus and warmth and a bunch of other things for the sinuses. The gist of it is that opening the sinuses up so that they can drain more freely doesn't take care of the inflammatory process that closed it off to begin with. So we weren't born with sinusitis, so there's obviously something that's changed. And things that cause all kinds of problems like ciliary dysfunction can cause problems. A word of that, if you've had sinus surgery, you don't need to smoke because a cigarette tends to slow down the motion of the little fingers that move the mucus and clean out the sinuses and the nose on a regular basis. That's going to stop things. So after sinus surgery, one of the things you were always told traditionally was to not blow your nose and sneeze with your mouth open, because as you cut the inside of the lining, it creates a pocket that air can be blown into, and that air can get into the eyes and the brain because you're close to those structures. So you don't want to blow your nose and sneeze with your mouth open unless you're instructed to do so by your surgeon. For the sinuplasty, in all reality, the likelihood of actually having a break in the lining that's of significance that you can put pressure through is fairly low. So we actually begin irrigation after a couple of days to help reduce the bacterial count, and we actually use a medicated irrigation. If you don't use some sort of treatment to cut down on the inflammation, like some sort of medication, allergy therapy, or something like that, the inflammation will eventually come back. So the idea here is to not only get it open so you can tolerate a little more swelling, but reduce that. So we usually start taking about 20 cc's of a medicated rinse that contains an antifungal, an antibiotic, and a steroid, and your surgeon may have a different concoction that they like to use, and they may have a different formula. So you need to be very specific with them about how you want to handle that. In ours, we typically do that beginning 3 times a day, 1 to 2 days after the surgery, after it has stopped bleeding. And it's normal to see a little bit of bleeding after surgery for a few days. And you'll take 20 cc's and we'll spray it out towards the edge of the eyes, this way, in the same nostril, in a small syringe with a nasal tip on it, and it just goes straight out, about 20 cc's out. It'll come out and go around the other side. It doesn't matter if it doesn't come out the other side, that's okay. Just blow out what's there. Any small amount of clots is a fairly normal occurrence, and that's basically what we do to begin with after the sinuplasty. We typically will continue that for up to 6 months on an every other day or once a day basis, but your surgeon is going to have a different formula, very likely. There's some different things that you can do with that. So I will leave that with you. I hope it's helpful, and we'll talk to you soon.